According to American Cancer Society, bladder cancer is rated as one of the most common cancers, and it is the fourth most common cancer in male, which accounts for 7% of the total cases reported in 2019. The usual treatment for bladder cancer patients is by surgically removing the cancer paired with chemotherapy. A common type of chemotherapeutic drug would be cisplatin. However, some bladder cancers are resistant towards cisplatin, which makes the effort of saving bladder cancer patients ineffective. To understand more about this resistive behavior, a study of cellular metabolites known as metabolomics can be done via Raman spectroscopy to see the relation between the metabolites in bladder cancer and its responsiveness towards chemotherapeutic drug. In my research, I am trying to study the difference in fatty acid, cholesterol, and squalene between four types of samples that differ in their responsiveness towards cisplatin via Raman spectroscopy. Moreover, I am also trying to find the difference between the four types of samples, which are complete response, partial response, stable disease, and progressive disease using principal component analysis, where the Raman spectra of the samples are analyzed. The generation of cholesterol in any cells begins in the mevalonate pathway at the serral branch of the pathway. FDFT1 controls the conversion of two molecules of FPP into squalene in the serral branch. Along the serral branch, cholesterol is created in succession, which is important for cancer growth and metastasis. Research done by Lee and her team in 2018 shows that cisplatin resistance in bladder cancer is linked to high lipid levels in bladder cancer. There are four types of samples prepared by pathologists from the Faculty of Medicine, University of Malaya, which have been categorized into complete response, partial response, stable disease, and progressive disease samples. Complete response samples means that the bladder cancer cells are sensitive towards chemotherapy, while progressive disease samples are samples that are resistant toward chemotherapy, and partial response and stable disease samples are intermediates of the category. Raman spectra of the samples are obtained using Raman spectroscopy, where samples are incident with a laser with frequency of 532 nanometer, and the scattered light from the samples are then detected using charge-coupled device detectors. Raw Raman spectra are then subjected towards pre-processing, where the raw spectra is baseline, smoothened, and normalized to reduce the noise in the spectra and makes the spectra easier to be analyzed. For the first part of my analysis, peaks in the Raman spectra for each sample are assigned to the vibrational mode of the bonds in fatty acids, cholesterol, and squalene to quantitatively distinguish the metabolites between the types of samples. It is speculated that these metabolites are involved in cancerous cells to support the production of tumor and cancer progression. However, the peaks for fatty acid and cholesterol were not prominent, especially in the stable disease samples, making it unsuitable to be included in this analysis. In squalene, the prominent Raman peaks that were detected correspond to CH3 rock, CH WAG out of plane, where it is located at Raman shift of 1003 cm power -1. A bar plot is done towards the average normalized intensity of squalene for different sample types. A statistical analysis known as Kruskal-Wallis test was done to see if there is a significant difference in the average intensity for every type of sample. The p-value obtained from the test was 0.4785, where it shows that there's no significant difference between means of every type of samples. However, a study done by Lee and her team in 2018 found that levels of cholesterol, ester, and triglycerides are elevated in resistant cells compared to sensitive cells. Based on the metabolite relation explained previously, resistant bladder cancer cells should contain a higher concentration of squalene, thus having a higher expression for Raman bands that are corresponding to squalene when compared to sensitive cells. Improvements can be done for the squalene peak statistical analysis to get better result by finding a peak in all samples that respond to a metabolite or molecule that has a constant concentration level in all the samples. This peak can act as the reference peak with known concentration, so that ratio between the squalene peak intensity and the reference peak's intensity can be done to directly compare the concentration level for different types of sample. Moreover, more samples are needed because the amount of bladder cancer tissue available in the Faculty of Medicine were not enough. Principal component analysis is done towards the spectra of different types of samples to differentiate between the types of samples by looking at the clusters in the PCA plot by reducing the dimension of the data, making it easily illustratable, but at the same time minimizing information loss on the data. Based on the PCA done on the samples, we can see that there are no visible clusters that can distinguish between each type of sample. The total variance for the PCA plot done is 45.75%, which is low due to the low number of samples for every type of sample. Improvements can be made for the PCA analysis by increasing the amount of samples for every type of sample so that we are able to see clear clusters of samples according to their types. In conclusion, according to Kruskal-Wallis test, there is no difference observed for swelling intensity between each type of sample, and the PCA analysis done between every type of sample shows that there is no cluster observed that can distinguish one type of sample to another. However, with improvements that were mentioned previously, a more accurate result can be obtained. Raman spectroscopy can be considered as a powerful tool to analyze cancer cells, which might replace the golden standard used in characterizing cancer cells, which is via histopathology. However, it is still undergoing trials to see its efficiency in characterizing cancer cells. Thank you.